Hi everyone, this is Dr. Cole Handy Jones here. Today I'm going to talk about how to fix your knee arthritis in less than 5 minutes a day. Before I get started, don't forget to hit the subscribe button, hit the like button if you find something that's interesting or new, and don't forget to put a comment down below if you have any questions. Let's get started. Osteoarthritis is one of the leading causes of disabilities in adults, and it's foreseen and projected that this problem is only going to get worse with an aging population. So we really have to find ways to fix it earlier and fix it better. Right now, the go-to treatment is a total knee replacement. There's a time and a place for something like that, but it shouldn't be your first and only option. Right now, about 550,000 total knee replacements are being performed in the United States every year, and that number is just increasing. Some of the common signs and symptoms that I see so you can know if you do have arthritis or not. One, if you're older, you're more likely to have arthritis. So if you're over 50 years old, it's more likely that you have an arthritic condition in your joint. The joint is usually swollen and stiff. It doesn't want to move well. That's both straightening your knee and bending your knee. Usually the pain will get worse with activity, so the more walking, the more stairs, the more getting out of chairs, things like that will usually cause the pain to increase or get worse. And also if you've been sitting for a long time, perhaps in a car or perhaps in your chair at work, and then you try to get up and move, it will often be more painful. If you've been told your only option is surgery, that's incorrect. There's 5 main ways that physical therapy can really help you with your arthritic condition. Number 1, it can help with range of motion. Number 2, it can help with strength to control the joint. Number 3, it can help with postural changes that will put that joint in better positions. Number 4, it can help with balance that will lead to better control of that joint. And number 5, it will fix that underlying cause or issue of why your knee is arthritic. I won't go into more details with this because I did an entire video about this. See the link right here to go into more detail of how physical therapy can help cure your arthritic condition. I'm now going to show you 5 exercises that I want you to start doing. These exercises are simple and kind of beginner exercises, okay? Listen to your body with these. None of these should be causing a lot more pain. It's normal for some of these to have a stretchy, tensiony kind of discomfort as we're trying to get the joint moving again, but none of them should be real painful. If they are, back off and listen to your body. But let's get started with these and give them a try. Exercise number 1 that we're going to do is called a heel slide. The first thing we want to do is just get the knee moving, okay? It's going to be really stiff and rigid. If we can get it moving better, there will be less swelling in there, less inflammation, and less pain, and it'll just move normally. A body that moves well is less painful and more functional. Okay, so for this one, I'm going to represent my left knee being the arthritic knee, okay? And I'm just going to lay down on my back, okay? So you're going to lay down flat. Exercise number 1, you're just going to take your heel, slide it in towards your bottom, and then slide it out. Slide in towards your bottom, and slide it out. I'm going to do about 20 reps of this. It's normal at the top to feel kind of a tensiony tightness, likely in your knee because it's getting kind of full from all the swelling. Just take it to the point that you feel that little bit of a tensiony, stretchy tightness, and then take it back out. Okay, you don't have to push this too hard, okay? But just keep going in and out. We're kind of trying to picture the knee a little bit like a pump right now too. We're trying to pump fluid in and out of it. This is one that I find my patients with knee arthritis absolutely love in the long term. It feels really, really good to their knee. That's the beginner or the starter one with this, okay? Step 2, what you're gonna do if that gets easier and easier, I want you to sit up. You're gonna slide your heel in and out the same way, okay? But this time, when you slide it to the very top, I want you to take your arms, you're going to grab your shin and give it a little bit of a hug, extra oomph, and then let it back out. Slide it in, grab your shin, give it a little extra oomph, and then let it back out. Okay? Same thing, we're just trying to pump fluid in and out of that knee and get it moving better. This will lead to less swelling and more range of motion, which will be huge for your knee. So that's exercise number 1. Exercise number 2 is going to be a quad set. So what we want to do next is we want to get the right muscles working correctly. Okay, so one of the biggest things for knee arthritis is to get your quadricep muscle, that's this big thigh muscle, to control the knee joint better. Okay, so for this one you can lay down or you can sit up kind of like this, but I do want your legs laying flat. Okay, what I'm going to picture doing is taking my affected leg, so for me it's going to be the left leg again. I'm going to try to take my knee joint, push it straight down into the ground while simultaneously trying to pop my heel up off the ground. So it's going to look kind of like this. I'm going to push my knee down, get my leg as straight as I can, hold for a second or two, and let it relax. I'm going to take my knee, push it straight down into the ground, hold for a second or two, and let it relax. And I'm going to keep going here, okay? When you do this at home, it might be a little uncomfortable, okay? A little bit's okay. If it's a lot, just don't push quite as hard or quite as far, okay? You might be doing this too and think it's really, really simple. And that's kind of the point, okay? All we're trying to do is to get this thigh muscle, this quad muscle, to react quicker and more efficiently, okay? We're trying to get the muscle memory from the brain down to this thigh muscle to be quicker and coordinated, to turn on and turn off as it should, okay? Every single step you take, this thigh muscle has to do a ton of work. So we want the muscle to be quick and efficient, okay? If you feel like you're having a really hard time to get this thigh muscle to turn on or to do this correctly, what you can also do is take a small towel, put it underneath your knee, and that way you can actually feel something to push down into, okay? Sometimes with my patients, in the clinic, I'll even just take my hand, put it under the knee so they can push down and just kind of feel that, okay? And once again, with each rep, I'm just gonna push down, hold for a couple seconds, and let it relax. Push down, hold a couple seconds, and let it relax. That's exercise number 2. Exercise number 3 is called a straight leg raise, and it's exactly as it sounds. We're gonna get the leg nice and straight, and then we're gonna raise it, okay? This is the first one that's gonna make the thigh muscle work a little bit, okay? So it's gonna be a little harder now. So what you're gonna do, you're gonna lay down on your back, okay? I'm gonna be representing, once again, my left leg being the one that I'm working. So I'm gonna take my opposite leg and bend it up, okay? By bending up this opposite leg, it's gonna help protect my low back. The last thing we want to do is to treat your knee and hurt your back. So bend up your opposite leg, okay? Once again, the left leg is the one that I'm working right here. I'm going to take my leg and start at the exact same as a quadricep. I'm going to push my knee down and pop my heel up. I'm going to hold it. While holding that, I'm going to lift my leg up off the ground. I only want you to go as high as your other thigh is, and then set it back down and let everything relax. Contract again, push the knee down, pop the heel up, lift it up, level the other thigh, set it back down, and let it relax, okay? The most important piece of this exercise is the straight leg. So always get your leg as straight as you possibly can, lift, and set it back down. Now, if you're having a really hard time with this one, that is very normal, okay? All you have to do is lift it an inch off the ground and then set it back down. So if you're having a hard time, get your leg as straight as you can, lift it only an inch or two, set it back down, and let it relax. So contract, lift it an inch or two, back down, and relax. This is the first one that's probably really going to fatigue your thigh and be a real worker, okay? That's normal and that's to be expected. Just do the best you can. As you feel better, start to lift it a little higher, closer to the other thigh, and then start to do some more reps, okay? But this is a real worker that's going to give that thigh the strength that it needs to control the knee joint. Exercise number 4 is called a short arc quad, or I'm also going to show you a long arc quad, okay? A short arc quad is the simpler version. A long arc quad is the harder version, okay? So for the simpler version, what you're gonna do is you're gonna lay down, and I need you to take something. I'm gonna use this foam roller. At home, you can take a pillow, a towel, or a blanket and roll it up. I just need something around this size to put underneath your knee. Okay, so once again, my left knee is gonna be my arthritic knee, or my problem area. I'm gonna put something underneath the joint like that, and you're just gonna lay down, okay? So when I lay down, all I'm going to try to do is straighten out my leg, hold, and then back down. Straighten out the leg, hold, and back down. So we've been talking about how important this thigh or the quadricep muscle is to knee arthritis and function. Okay, and this is the best way that we have to really isolate that thigh muscle. Okay, and same thing, every time you lift, you're trying to get that knee as straight as you possibly can. Hold for a second or two, and then let it relax. Okay. This is one that's going to be a little bit of a worker as well. Your thigh might even get a little bit sore after doing it, okay? But is huge to knee function, strength, and control, okay? Try this first. If you do this and it's crazy easy, you feel like you could do it all day, then I would try step number 2 to this exercise, which is the long arc quad. Okay, so step 2 for the short arc quad of the last exercise that we're doing is now called the long arc quad. So the only difference with this one is I need you to get in a chair, okay? You can do this in a chair or on your bed or something like that. It's ideal if you have something that goes to the very edge of your knees so your knees can kind of hang there, okay? But with this one, all you're gonna do is take your leg and just put it straight out and then come back. Put it straight out and back. So this is just a little bit harder than the short arc quad, the one that we just did laying down, because now I take my leg and I put it even at more of a disadvantageous place, and so it has to work harder, that thigh muscle does, okay? And same thing, it works even better if you have something that comes right underneath your knee and you can kind of be hanging down off the edge of the table or something like that if you can, okay? Same thing with this one, get your leg as straight as you can, contract the thigh muscle and let it down, okay? Once again, this exercise is the single best way we have to really isolate and strengthen your quadricep muscle, which is huge to knee pain and be able to control that joint. And that's your handy physical therapy tip of the day. Keep looking forward to more videos on a weekly basis.